Good morning, everyone. Good day, good evening, wherever you are in the world listening to us today. My name is Ben Blanquera, and welcome to CDO Magazine. I'm with Rackspace Technology, a leading provider of hybrid cloud and AI services for firms in the data analytics and AI modernization journey. This year, we're speaking to leaders across the globe, talk about their experiences with AI with Dr. Dominik Nowak, President of the Ontario Medical Association. Welcome, Dominic.
It's such a pleasure to be here with you, Ben.
It's a pleasure to have you. We were talking a little bit earlier. It's chilly all over the world today, and I hope everyone is staying inside. Let's go ahead and get started. Why don't we? Dominic, can you share a little bit about yourself, your background, your organization, your current role?
Yeah, I'm Dr. Dominik Nowak. I'm a family doctor myself at a place called Women's College Hospital in Toronto, in a family practice attached to a hospital, and also president at the Ontario Medical Association. This is an organization that's really the advocacy voice for the almost 50,000 doctors in Ontario towards a better healthcare system. And in Canada, in Ontario, things are challenging in healthcare right now. A few
Mhm.
days ago, we saw headlines globally around a new family doctor signing up in one of our rural communities, and they
Hmm.
had over 1,000 people lining up in a snowstorm starting at 2 a.m. in the morning just for a chance to get registered with a family doctor. So we have severe challenges in healthcare, and really happy to be talking about how AI technology can be tackling those big challenges that we have in Canadian healthcare.
That is fascinating. So let me sort of just recap: 50,000 docs servicing how many million people?
It's around 15 million people in Ontario.
My goodness, and we're here to talk about how AI can solve some of those problems. Let's talk about that. Um, so, paint for me a picture, Dominic, about what's happening in the medical community that you think AI can solve.
One of our big challenges right now is what's called the administrative burden, right? And that's
Hmm.
what my colleagues, doctors across Ontario are telling me that's crushing in terms of their workload. They love doing the patient care. Doctors love doing the care. They train to do the care. It's the paperwork, bureaucracy, the red tape that's crushing, that's, pulling us away from patients. And then frankly, pulling us away from our free time at the end of the day and on weekends as well. So doctors are doing 19 hours per week of unnecessary red tape, paperwork, bureaucracy that's burning them out and then also taking us away from the patient care that we want to do. What that looks like on a day-to-day basis. I'm a family
Hmm.
doctor myself. It's sending that referral. It's following up on that referral. It's chasing down that fax. It's doing the insurance paperwork, the
Hmm.
forms, the documentation after the visit, and so much more. And what it looks like a lot of the time is actually advocacy. Right? I needed an urgent referral for one of my patients a few months ago, and
Hmm.
it took me 4 or 5 different uh, referrals to several different hospitals nearby just to get them appointment 9 months later, right? And what it also looks like is that evening and weekend documentation time sitting by the computer in the evening hours at 10 or 11 p.m. And that's pulling us away from patient care and actually pulling us away from our families as well.
Oh my goodness, that's I've heard about the administrative burden from an insurance and those kind of things. What wasn't clear to me is the work with the advocacy kind of work, because as docs, you want to do the best for your patients. So you spend that much time doing the advocacy for
Yeah,
your
and it's
patients.
what it often is that 19 hours weekly of unnecessary bureaucracy red tape. People might ask, why don't you hire someone to do that, or why don't you delegate that? A lot of the time, with the way our healthcare system is set up in
Hmm.
Canada, in Ontario, these are things that doctors are needing to do to advocate for their patients, right? Like follow up on that referral, like the
Hmm.
documentation time, like
Hmm.
the robust form filling
Yeah.
that we end up having to do. So we need the system to step up, the governments to step up and take that off the plates of doctors. So right now, it's actually very hard to delegate.
My goodness. So if we're talking 19 hours a week, uh, how many patients can you see in 19 hours? Like I'm just looking at the impact. If there's a backlog of folks waiting to get into doctors, like how many people get impacted because of that administrative burden?
Yeah, listen, it depends, right? It may be
Hmm.
a few per day if you're a specialist, could be even 100 if you're a rapid urgent care center that's dealing with several patients per hour. It could be anywhere in there. But the bottom line is that the administrative burden is crushing and also taking us away from patient care that we want to do.
Got it. And if you could plot a trend line, or is it getting better or worse? What does that trend look like for this
Yeah.
problem?
We have a population that's older, sicker, living longer with more medical conditions, and then also, unfortunately, with more social needs and social complexity, right? Which ends up needing more documentation and form filling and these sorts of things for advocacy. So I'd say that the trend line in the last few years has been increasing in terms of that documentation burden and the administrative burden rather than decreasing. There are some things that the profession and governments are doing to cut down on that, but they're not nearly enough to get us past that 19-hour mark.
My goodness. So not only are patients impacted, like talk to me about what is the impact on doctors, the psyche on of this, and the ability to attract doctors into the profession.
The 19 hours per week of unnecessary red tape bureaucracy that we're navigating is crushing to doctors. That's what I'm hearing across the province. And what it looks like is, again, that 11 p.m. at night catch up time where we're spending time by our computers rather than recovering for the next day. What it also looks like is cognitive load during patient visits,
Mm,
right? When you're with your doctor, you expect your doctor's attention and cognitive load to be entirely on you, and you want them focused on your health. In reality, our cognitive loads are being drawn to our computers, to the documentation, to everything that we need to do to be proactive around that 19 hours per week of red tape. And that's at the expense of cognition for the actual medicine of the visits. And that's why when we see some of these innovations come up, one of the big benefits is on cognitive load so that doctors can focus on the patient care during the visit rather than
mhm.
focusing on the computer.
Wow. So we're seeing a sort of multi-threaded sort of solution and opportunity with getting more patients seeing, improving the sort of work life kind of work for docs, and then improving the patient experience with the doctor being more fully present during it. That's factual. Let's talk about like, I'm sure if you talked with your organization, like what are some specific applications or things that you can see AI can solve that is happening right now?
Yeah, and Ben, you're right. It's better patient care when we take that 19 hours per week off the plates of doctors. It's joy in work, so restoring joy in work to medical practice. And then it's also access to care, so getting people the care that they need versus right now the situation where doctors are being drawn to the administration and the bureaucracy of the healthcare system. And the big application that's already here is something
Yeah.
called AI Scribe, right?
Okay.
So you imagine a world where you walk into your doctor's office. In a
Mm-hmm.
regular world, your doctor's attention might be actually be split with either their paper notes, sometimes or most often their computer, right? Because they
Mm-hmm.
be taking notes to remember some of the things that go on in the visit, and then
Mm-hmm.
also have thorough documentation around what happened during the visit, the things that you discussed, the decisions that you made together, and
Mm-hmm.
technologies like AI Scribe basically have in a privacy conscious way a computer listening into the conversation and creating a note from that. And that note will include everything that the doc needs from a medical legal perspective in terms of documentation and history and for review later on. But then also, what decisions did you make? What were the conversations that you had during that visit? And then what are some of those things that they might want to share with you after the visit that would be helpful for you in your health?
And that's got to be groundbreaking for some of these docs to not have to do that. I'm curious, where are you at? What stage is this technology? Is it pilot production or where are you at with this?
It's ready. It's ready
It's
for work
ready.
in healthcare. It's already being used by many doctors in our province. If you asked me a few months ago, maybe you'd have occasionally doctors raising their hands who are using it. We're at this tipping point right now where Right now, maybe 1 in 2 out of 10 doctors in Ontario are already using AI scribe technology in some way to help them with patient care. And it goes back to those three things that you mentioned earlier. Better care for more people, that's
Mhm.
more joyful for doctors because we get to focus on the patient care rather than the documentation time and the administrative burden.
Oh my goodness. I love sort of like I have this tagline in my brain, AI for joy and health now. It's sort of
Yeah.
like resonating through my brain.
Yeah,
I'm curious. Go ahead, Dominic.
and listen, it's if you end up using something that takes the administrative burden off your plate as a doctor, doctors are saying that they can be better doctors, they can be more responsive to their patients, and it's more joyful for them because they get to focus on what they signed up to do, which is the patient care rather than the bureaucracy.
Oh my goodness. That's got to be could be life changing for many of these folks. When there is risk associated using AI. I'm just curious. How do docs look at the risk associated with something not hearing correctly, something not putting notes? Like, I'm just curious, how do you managing the risk side of implementing this?
Yeah, and I'd say doctors are very careful and have it as a priority to make sure that anything that goes into the medical record is done with care because it does have an impact on patients and
Sure.
patient care in terms of the the type of planning that we do going forward, the decisions that we make for treatment in the future. If
Hmm.
another doctor sees you as a patient and reviews that previous note, then some of the visit might be influenced by some of the ideas, the plans, everything like that were in that previous note. So it's still important that doctors are reviewing the notes
Hmm.
afterwards that are generated by AI, but it takes that initial cognitive load that right now we as doctors are doing during the visit, after the visit, or usually actually in the evenings after that entire busy day. It's taking that cognitive load off the plates of doctors and letting us focus on the care.
That's amazing. I'm not a doc, but I use AI notes in every one of my meeting, and it has shifted, like you said, my cognitive load from writing it down and documenting to more actively listening and
Yeah.
participating.
And
Yeah.
we know that relationships make the difference in healthcare. People
Hmm.
who have a consistent, trusting relationship with their family doctor or their specialist and having better care, fewer emergency department visits, fewer hospitalizations, they end up costing the healthcare system less money. Those relationships actually matter. So just like you said, Ben, in meetings, that it helps you build relationships rather than focusing on the
Yeah.
documentation. The fact that this lets us focus our cognitive load on building the relationship and doing medical care, that actually is a matter of life and death in healthcare.
Yeah. There are no higher stakes than what you all are doing in these patient visits. I'm curious. So you said this is commercially available now. Is this literally they buy the service and they implement it
Yeah,
and
what
you
we're
can
seeing,
just
yeah, we're seeing several different options for doctors, and what we're doing at the Ontario Medical Association and Ontario MD, which is a subsidiary of the Ontario Medical Association, is we're making sure that the opportunities, the options available to doctors, to clinics, are grounded in good care, that they have good follow through support. We're looking at the type of customer service that they have, and that
yeah.
our doctors are happy with the solutions that are coming in,
Okay.
so
Okay.
that they could give the best care possible. So that's
Okay.
some of our advocacy work that's happening behind the scenes right now.
Yeah, well, it's got to be a huge search. So you're vetting out some of these things and presenting them to the docs.
Yeah, that's one way of thinking about it. So that when doctors are coming up with which of these types of opportunities they want to take on for their clinics, for their patients,
Hmm.
for their communities, we'd give them an idea of what are the pros and cons, what are the types of things they should be
Sure.
watching out for. Are there any special privacy related questions or other legal
Mm,
requirements that they should be asking if they're going ahead as early adopters? And
mm.
what are those ideas that they should be thinking about to make sure that they could get the most out of these technologies for their patients?
That's fantastic. Thank you so much, Dominic, for your time. I appreciate you being on here today.
Such a pleasure, Ben.